So I grew up in New Jersey in a blended family after my folks were divorced when I was fairly young. I had two very successful male role models in my dad and my stepdad, who were both very successful businessmen. But it was my mom who was the constant and driving force of my life. She was the one who kind of cheered me on daily and taught me some of the major life lessons, taught me how to relate to girls, how to be kind when I felt angry, how to be tough when I was hurt. It was her involvement that really got me going into medicine. Recounting her tales of working in the operating room as a nurse really spurred on my interest in medicine. I knew early on, I knew by 7th grade that I was going to be a doctor. I was going to med school. I grew up, I was sick a lot when I was younger. I had pneumonia once a year, bronchitis twice a year, constantly in and out of the doctor's office for allergy shots. And you know, I got used to going to the doctor's office, but I never liked it. I never liked the feel of being in a doctor's office. That stark, sterile environment just didn't work for me, and it always gave me an uneasy feeling. I mean, I even got used to the protocols and the allergy shots every week, but it was being there that made me uncomfortable, and that kind of plays into how I designed my practice later on. Early on, I knew medicine was for me. I knew that I wanted to go initially into psychiatry. I thought that was going to be something fun, but also I realized early as well I was not going to be internal medicine. I had to do something where I was going to see a result fairly immediately. I got into med school. It really was the first day of anatomy class that I knew surgery was going to be it for me. Growing up, being sick very often, being in the doctor's office, not liking their environment, also kind of rebelled a little bit against standard or old school medicine. The allergy docs told me, you know, you should play sports. If you're going to play sports, you should play indoor sports, not outside sports. You should be a swimmer or go do bowling or something. And that just wasn't acceptable for me. I was into football and lacrosse, and I kind of pushed and made sure they maximized my medical treatment so I could play sports. I was a good athlete. I was good enough to actually make it on as a walk-on for Notre Dame and play football for them, and played under legendary coach Lou Holtz. And that experience was just phenomenal. I learned so many life lessons there. And he was different than other coaches. He was the type of guy that was interested in you as a person, not just a player. In fact, he would say stuff like, you know, people don't care how much you know until they know how much you care. And he would tell us after practice, he'd gather us up and say, all right, men, who did something nice for somebody today? And let's just realize that the words we say and the actions we take can affect people in a profound way. And that's just not something you typically hear on a football field. So he was interested in developing character. And that's something that I try to continue on with my family and my children, to make sure that they do the right thing. That was another big one of Holtz, of living life with integrity. And that's, again, how I try to conduct my practice, my business, my life in general. New Orleans was awesome. I wanted a place for medical school where I was going to be exposed to everything. I didn't want to come out wondering, gosh, what if I'm exposed to this? What if I am faced with that? And New Orleans had it all. I mean, it was crazy. For instance, the first day of med school, I show up in my short white med student coat, go to the renowned charity hospital, and some guy, doctor, breezes by and says, hey, you here, throws a chart at me and says, go sew up bed 4. And then the guy is off. He's too busy to deal with me, and I'm stuck holding this guy's chart, and I'm saying, I can't sew, I don't know what I'm doing. You know, I muddled through, the patient I muddled through that day, but I was taught a pretty profound lesson. You know, the lesson was, if you show up, Dr. Mike, you better be prepared. During residency, you know, I knew I wanted to do surgery. I thought I wanted to do orthopedics because of the sports background. There's a lot of sports medicine guys, ex-athletes. Then I did a rotation on plastics and just loved it. I mean, it really fit my personality. It fit my creativity. I mentioned earlier that I was slightly thinking about psychiatry. There's some of that aspect as well. And I love the fact that I could talk to patients, number one, figure out their problems, and then everybody's problem was different, and it was exciting every new patient that I got to encounter was new. It wasn't the same boring rote surgery. And we get through to my last year in residency at Tulane, my 5th year, and Hurricane Katrina hits. So we are basically disbanded. There's no residency anymore. The storm hit on Sunday. By Thursday, they're telling me, you got to find a place to go, and here's your 4 options. At this point, I got one child. My wife, in-laws live up in Mississippi, so we investigate up at the University of Mississippi. Hey, can I finish out my year? And I had already applied actually for plastic surgery there. And I ended up finishing that last year general surgery, and then going on to do plastics there. And it was awesome. They've got one of the largest plastic surgery practices in the country, and I would bounce from room to room and get full exposure on the full gamut of plastic surgery. When I was in college, we played Vanderbilt here in Nashville. I remember flying in and thinking, this place is gorgeous. It really had everything that we wanted for a family. We wanted to be able to raise the kids in a good environment. We wanted to have an area where business can thrive, where medical stuff was on the forefront, and where we could have a home where we could feel comfortable being the people we wanted to be. We knew we should be. Nashville's got it all for us. We've got the cosmopolitan feel of a city, but yet a small town feel as well. So my wife and I made the decision we're going to move up here in 2009 during one of the worst recessions ever. Joined up a practice and again, tried to continue along the lines of doing the right thing and treating people the right way. It was good. It was okay, but it wasn't. I couldn't be as successful as I wanted to be. As plastic surgeons, we all have our way of doing things, and I always felt that I wanted to treat patients better, with respect or with dignity. I wanted to develop a practice where my mom or my wife could go and feel comfortable, and I just didn't feel comfortable or confident doing that in this other practice. And so branched out on my own and built my practice kind of from the ground up, and really focused it. It was a patient-centered practice. It was not going to be a practice that was going to run patients in and out as quickly as possible. We were going to take our time with each other. I was going to be able to talk to them and understand their fears and their concerns, treat them like people, not like a condition or a disease to be solved or dealt with, and really focused it all on the patient experience. And we talk about it now today. We want to have an unparalleled plastic surgery experience. To me, plastic surgery, the results are a given. And I think what makes us different is what we do in addition to the results. How do we treat you? We want to treat you like family. I wanted to have staff that was going to be overwhelming you with kindness and customer service. I wanted to have a place where you could come in and feel comfortable, not that stark, sterile environment that I was used to, growing up. It goes back to some of the other stuff where I didn't always agree with everything in medicine. Going through med school, I heard countless stories and experienced this. Doctors were very good in the operating room, but they had no personality, and they were jerks. It was, he's a surgeon. He's got to be that way. He's got to be, right, precise in the operating room, so he doesn't have time for this fluffy stuff. And I just don't understand that. I mean, you can talk with somebody, have a conversation, treat them like a human being, and then do your job in the operating room. I don't want to be one of those practices, I've never wanted to be, where I was pushing patients through as quickly as possible, like a mass production machine. I take an hour with each patient when I first meet you. I sit down with you, I want to understand your concerns, your fears, your desires, really get to know you as a person. I started the practice in 2012, moved over to a beautiful office, and have been growing like crazy. And it's funny because when I started the practice, when I decided I was going to go out on my own, I turned it over in a month. And it was one of these crazy things where everything fell in line, and I got a loan within 30 days, got a place to practice, set up all the logistics, all the computers, hired staff, a website, all this stuff. And I've always had that quiet confidence that I was doing the right thing. But this really comes down to my faith and my belief in God, that he was involved in all this, and to make it happen in a month was just unbelievable and really gave me some more confidence. I think we're close. I do. I think I've done a lot of things the right way. I've certainly made my mistakes along the way, but it haven't been drastic mistakes. And you know, you always say it is, as you make mistakes, you build from it, you learn from it. So those experiences were meant to be. I think God's put me on the right path and given me the right opportunities and involved me with the right people to do it. And I'm still learning and I'm still making my way through this, but you know, it's been fun along the way. I've always wanted to live my life, and I'm trying to impart these lessons on my kids. I don't want to live with regrets. I don't want to think back 10 years or 5 years and say, gosh, I wonder if I should have done it this way, or I could have done that. I'm honored when patients choose me, and can't thank them enough for coming to Music City Plastic Surgery.